Welcome to the Caucus Corner. I am Michaelle, Solages, chair of the Black, Puerto Rican, Hispanic, and Asian Caucus. And each week we discuss budget and policy issues that impact New Yorkers from the perspective of communities of color. We know that at times policy can be tedious, but here at the Caucus Corner, we want to spice it up. We want to bring it to the people. So join us for a deep dive on issues that pertain to our community. And we want to also uplift the democracy that we so love. So grab a snack, a drink of choice, and get ready to hear about legislation and our demand for justice. So today we are joined by our fantastic colleagues in the caucus to give an overview of a bill which is important to many of us. It's S8907 for all you guys who want to, get bill numbers. It's also known as the Hospital Moratorium Closure Bill. And so I want to introduce our panelists who are going to talk about this issue. So first, I want to say hi to Senator Gonzalez. Hi, Senator. Are you there?
Hi, Assembly member. Yes. Hi. So good to be here. Thank you for having me.
And if you want to just give a quick, introduction on where you represent and who you are.
Absolutely. So I am the state senator for District 59, which covers Western Queens, Astoria, Long Island City, Northern Brooklyn, in Greenpoint and Williamsburg, in the east side of Manhattan from 14th Street all the way up to the UN. And I am born and raised in Queens, really excited to be in my first term.
Oh, very nice. We appreciate you being here. And then we have the amazing Assembly member Latrice Walker. Is Brooklyn in the house?
Brooklyn is always in the house. And thank you so much for having me, Chair Solages. I represent Central Brooklyn, the communities of Brownsville, East New York, East Flatbush, Cypress Hills, Crown Heights, and East New York, and a little East Flatbush as well, where SUNY Downstate is located. And so we are excited for the Senate bill and the moratorium to take place. And it's a pleasure to join you today.
And we appreciate your advocacy. So let's just get into the nitty gritty of the bill. And so the Hospital Moratorium Closure Bill, Senator, do you want to describe what it is and how you came about to submit this legislation?
Yeah, absolutely. I first want to give a little bit of context so folks know kind of the bigger picture and why this is urgent in this moment. So as a lot of folks have seen, we are seeing a trend in hospital closures, whether it's the shutting down of services or the proposed closures of entire hospitals. So that starts with SUNY Downstate and the incredible organizing that the Brooklyn electeds like Senator Myrie have been leading for some time now. And then in my own district, it relates to Mount Sinai Beth Israel, where Mount Sinai has moved to close Beth Israel, which would potentially leave 400,000 lower Manhattanites affected by this because they wouldn't have a nearby emergency room. And going through this process, we actually had two pieces of legislation. One, we worked with the chair of the Senate Health Committee, Gustavo Rivera, and in the Assemblymember Joanne Simon, on an updated version of the Litch Act, which recently passed the Assembly, because we realized that the individual closure process that the Department of Health oversees is pretty incomplete. And the biggest way that it's incomplete is that it doesn't have a ton of community engagement. So we, updated the Litch Act to create a 2024 version. And we, want to ensure that we pass that this session so that communities are at the table, especially when it's their health that's on the line. And then with the moratorium bill, which is a second bill, it's a complementary bill because we realized not only do we need to improve the individual hospital closure process, but we actually need a higher level study of what the impacts will be on marginalized communities, on beds, if we not only close multiple hospitals, but if we close the 12 other, hospitals that are down the pipeline, or the 21 distressed hospitals that are at risk of closure in upstate New York. So without, doing a statewide study that actually gives us a higher level view to inform how we're operating on the local level, we shouldn't be moving to close any hospitals, especially when we're still in a health crisis.
And it's so true, as you said, like this disproportionately impacts the most vulnerable communities of our state, whether it's upstate, downstate, these are our communities that we represent. And I know that Latrice, you've been kind of going through something like this.
Yeah, so one of the things that we have noticed is that there's been a trend within the state of New York to close hospitals, particularly our safety net hospitals, which provide healthcare resources to our most vulnerable communities. And one of the things that, we've been pushing is the fact that your zip code should not dictate the quality of healthcare that you receive. Many times, we find that the reason for suggesting that a hospital close is because the hospital is not sort of receiving the type of resources that it needs in order to stay open. But we know that there are a number of dynamics which are involved in hospital closures. And particularly one of the things that we're finding is a hospital like SUNY Downstate, where over 90% of the patients receive Medicaid. And Medicaid has been reimbursed at a rate which is 30% less than private insurance companies. And when you are not funding healthcare at the amount that it's billed at, you are setting the hospital up for a deficit at the onset. And so in addition to the moratorium, to have a conversation with the community with respect to preparing a community for not having the same number of beds that it used to have, it still, sets us again at a significant deficit. One of the things that we notice with respect to our hospitals is that the greatest impact will be on communities of color and neighborhoods with the highest concentration of poverty. And I, for one, can't sit idly back and let an entire community and a workforce and nearby businesses suffer. SUNY Downstate is a vital safety net hospital that treats everyone who walks through the doors, regardless of their ability to pay. Of course, most of the people of color have limited access to quality healthcare, which ought to be a basic human right. So we have to take the necessary steps to make sure that it doesn't happen. Not this time, not ever. So I wholeheartedly support the bill being discussed today, which establishes a moratorium on the closure of hospitals until the Department of Health completes a thorough analysis of issues and report on the impact of a potential hospital closure in the state. It's simply the right thing to do. And there's no example quite as clear as the potential closure of SUNY Downstate and Mount Sinai's potential closure of the Vital Hospital in Manhattan. The failure to save these hospitals only exacerbate healthcare disparities that already exist in these neighborhoods. The failure to save our hospital will decrease life expectancy and send a message that to some people in Albany that people don't care whether or not poor people live or die. SUNY Downstate, for instance, is a hospital in Brooklyn with a kidney transplant program. Those patients will suffer. SUNY Downstate is one of the only 2 regional perinatal centers in Brooklyn. People will suffer. Between 20 and 50% of the workforce could lose their job. There are some of the same workers who were on the front lines at the peak of the pandemic when SUNY Downstate was designated a COVID-only hospital. Everyone calls on these hospital worker heroes. And now a significant number of them who risk their lives every day and face an uncertain future is not being given the thanks that they deserve. So let's roll up our sleeves, shout it out to the mountaintops, march in the streets if we have to, call on your senators and your assembly members and the governor's office. I will fight, of course, for the essential hospitals, not only through legislation, but also through the state budget, which we're seeing sort of roll itself out before our eyes. And we're also calling on our congressional leaders to step up as well and identify $1 billion in order to keep our hospitals open.
And it's exactly what you said. It's expensive to be poor. I've heard many times of individuals saying they try to access healthcare and they've been delaying healthcare because they can't afford the bills. And many people have fallen into medical debt, which is, a whole nother caucus corner that we could do, right? So, I know that I want to step back a little bit and talk about what the current procedure for hospital closing are. And I know a senator or assembly member, do you want me to go dive into that? Do you have some comments on that about current procedures?
Yeah. I know this is a podcast, so y'all couldn't see me clapping, but can we get an amen for what Latrice said? No, it's just so many important things, I think, in what Assemblymember Walker just brought up. And I think like, happy to turn it to you, Solages, to go through what the closure process is. But again, the biggest call out for us is if the most vulnerable of us are going to be affected by losing beds, by having hospitals closed, there shouldn't be any decision made about us without us. So I think like the biggest thing we've been focusing on, at least with that new version of Lich Act, is the community engagement piece. But then with the hospital moratorium, also just the inadequate amount of data we have around what types of services. I think Assemblymember Walker mentioned some really, really critical services that SUNY Downstate provides. And so, a lot of hospitals will argue, well, you know what, the hospital next door, they can do that too, right? Like it's fine. But then that hospital next door will say, actually, we're at capacity and we could not take on more patients to help with that service, or just we do not have enough beds for emergency services, things like that. So without that higher level view of just what the current scope of the problem is, or what health access looks like, especially with so many hospitals that are vulnerable. And again, with the emphasis on safety net hospitals right now too, I think that's what gets really dangerous for our community, because we don't have the tools as legislators to say, hey, like we do not have a way to fill in these gaps if we just lose this hospital or lose these services altogether,
It's so true, really. And, I know that there's many questions that come about with this, because, people can say, we're closing a hospital, we're redoing a hospital, but there was really, it's really, as you said, the community engagement piece is not there. So, going back, in order for a closure of a facility to be initiated, it must be sent to the Department of Health about 120 days prior to the date of shutting down. And a patient, a resident, a next of kin, a physician, and a sponsor must be notified by the Department of Health. I know for you, what's happening in Manhattan, how do you feel about that procedure? How did it go? Like that 120 days, was there panic in the community?
Yeah, it's been woefully inadequate. So even though with, I think, the new health equity impact assessment that Senator Rivera passed into law in 2021, which helped improve some of that community engagement, it actually doesn't apply to closures of entire hospitals. And then currently hospital closures are carried out through a simple notice to the Department of Health, right, about the overall closure plan. And they have to file a certificate of need application. So what we found out, and this happened back in October, is that, Mount Sinai had actually indicated before that they, were moving to close, but it wasn't something that they communicated to the electeds at all, that they, shared with the community at all. And so, in October, they basically filed that application with a proposed closure date of July this year, giving us only a few months to figure out, what to do or what this meant for our community. And I think that was really devastating for all of us. And then in addition to that, to add insult to injury, so you have this really tight timeline, right? Where you have this really essential hospital on the line. And, we're left out of the loop. We basically, or they had a town hall. And what we saw basically was that the town hall itself, the one that they had, because again, there was a bill that passed that said they had to do some of that, was not with advance notice for the community. It was in a venue that was much too small. So there were people who were turned away. And it was, it actually made the community that much more upset. And so, just speaking to the process, speaking to the community engagement currently, it was, like I mentioned, woefully inadequate. And then on top of that, when we turned to the Department of Health and we said, hey, Mount Sinai in this application is saying that the service that this part of Manhattan, the 400,000 people we mentioned, will be covered by their other locations and other hospitals in the area. But what data do you have that shows us that those hospitals have capacity? Because we're hearing again that they do not, right? Bellevue was saying, for example, they need $100 million in order to absorb new patients. The Department of Health turned to us and said, we don't have that data. We can't give that to you. We can't fully give you information on, again, what the impact would be on marginalized communities. And considering that Mount Sinai Beth Israel has so many patients that are people of color, that are lower income, especially in those communities as well. And so that's why with the Moratorium Act, we're saying we can't keep moving towards closures without the necessary data, without the transparency. And what I'm really excited to share is after, this months and months of fighting with the Department of Health, fighting with Mount Sinai and calling on them to do better, rallying in the street. Advocates even filed a lawsuit, a cease and desist that Mount Sinai didn't respect, that the Department of Health found that they weren't respecting. This week, the Department of Health actually filed or actually returned the application for closure to Mount Sinai saying, hey, there are critical gaps in this application. There are critical gaps in data. So for us, that shows that we were right the whole time.
That's a win for the community. That's a huge win.
Yeah, we could not be more excited to have gotten this far, but I think the fight isn't over. And that's why we still need to pass this bill before, again, not only other hospitals are going through this or before they reapply, which inevitably a lot of these private or not-for-profit healthcare networks or hospital networks will do if they're losing money in a location.
So, I mean, for both of my colleagues, what can we do to really support this piece of legislation or really galvanize support around making sure that our communities have adequate health care?
Well, I think for starters, we know that our advocacy is a verb. It's not just what we say, it's what we do. And so we definitely in the final days of the budget, particularly, as it relates to the deficits that a number of these hospitals have been functioning at, is to call on our government, particularly the governor, who the budget particularly responds to the governor's proposal. And we push back and in our Assemblywoman house, as well as in the Senate one house, did not include the closure of any of our local hospitals, but instead to insert at least $300 million to deal with the deficit that we're finding now, and another $100 million in order to deal with some of the infrastructure changes that we need. We know that healthcare it has been significantly transformed nationwide, and we're trying to move towards a healthcare delivery system that values more in-community primary care physician type healthcare delivery. And so we do need to have more local healthcare providers within communities in order to prevent the type of diseases and emergency situations that call on folk to be hospitalized. We know that hospitalizations are not necessarily the things that are keeping us healthy because the stays have just been significantly longer. And we put sometimes our patients in a bad situation when they have to overstay within hospitals. And so we need to provide more mobile clinics, community health care facilities, urgent care clinics as well. But we also need to make sure that as we see a looming and boosting development of New York City, particularly central Brooklyn, we have more residents here than we had before, when we had a number of more significantly critical hospitals within our neighborhoods. And since we have seen over the past 10 years closures of hospitals, we know how important it is. For instance, as we went through with Lich, and we learned a significant lesson there in terms of saving SUNY downstate. We also had a blueprint which was set aside when we put in a significant number of money for One Brooklyn Health, which included saving hospitals such as Interfaith Hospital, Kingsborough Hospital, and Brookdale Hospital. And so we know what it is that we have to do. We have to put our money where our mouth is and not just go towards a closure of a hospital, but instead provide a right-sized healthcare delivery system that serves the communities of color, but also provides top-notch and quality healthcare that our communities deserve.
Well said, Assemblywoman Walker. And we appreciate, both my colleagues being here. Any last words to leave with our fellow New Yorkers?
Yeah, I would, definitely echo what Assemblymember Walker brought up. I think in the long term, we have to fix a lot of these structural problems in our healthcare system, whether it's the Medicaid problem, whether it's just, again, the quality of care, a lot of the things that she brought up. But I would say for New Yorkers in the short term, it's really important for us to band together in this, because if you come for one hospital, right, you come for all of them. That's something Senator Myrie has been saying in the context of SUNY downstate. And that's why we're fighting in the short term to make sure that we're stopping the clock, right? That we are passing a moratorium and we're taking a moment to collect the data, or requiring government to do better by collecting the right data, identify designated distressed hospital zones, and then actually use this to create some sort of longer term plan, because we can't keep closing hospitals ad hoc without that longer term, because what we're doing is really playing with people's lives, right? Playing with some of the most fundamental rights, which is the right to health, right? The right to healthcare. And so I would just really leave New Yorkers with, or encourage everyone who might be listening or interested in this, to support these pieces of legislation, to call their reps, and then also to understand that, we're all part of this bigger fight, because it's not just downstate, it's upstate too, that is incredibly vulnerable. And if we want to build a better New York, it's going to take not just being focused on one area, but for us to be focused on the state at large and what our state legislature is doing around these issues.
Exactly. From Buffalo all the way to Montauk. Healthcare matters and everyone deserves access to it.
Yep. Yep.
Well, thank you so much for having significant sort of dialogue as it relates to the things that we need to do, from the press conferences that are held to podcasts such as this, where we are educating the community as it relates to the things that are taking place in Albany, because as we know, all politics are local. And so it has been a pleasure to participate in today's discussion. I look forward to the continuing dialogue in the final sort of looming days of the budget, and ensuring that legislation such as the moratorium, as well as the notice requirements to the community, the community conversations, which are necessary, and funding the studies that we need to provide right-sized data in order to support the decisions that are made. We know that one of the last sort of research opportunities that the state has conducted as it relates to critical care within our communities was the Berger Commission, and that data is significantly outdated. And so we must provide the research and the data which is necessary to support any critical changes to healthcare that the state, as well as our federal partners, are looking at doing throughout New York.
Well, thank you to both of our colleagues. This was a great discussion. And so with that, we close out our episode of the Caucus Corner, and we hope to see you next week. Thank you.
Thank you so much, Assemblymember Solages. Thanks for having us.
Thank you.